Welcome to the next episode of Conscious Physician, Medicine, and Psychedelics. We have a very, very special guest today, Dr. Kendra Campbell. She is a psychiatrist, and I've followed you more than I know you. But I feel like you're so authentic in what you post that I feel like I know you, sort of. Tell us about yourself, Kendra.
Sure. Yes. And that's so awesome. And I try, that is my goal, by the way, is to try to reduce as many filters as possible and be as transparent and like authentic as possible. That's how I like to sort of live my life. So I'm a traditionally classically trained MD psychiatrist. I actually have two fellowships that I did in at Columbia University, one in emergency psychiatry and one in public psychiatry. I worked for about 4 years in a very busy psychiatric emergency room in New York City and doing, conventional psychiatry. And I found myself eventually extremely burned out, very burned out. I had numerous medical problems, lots of mental health problems, anxiety and panic attacks, insomnia, and just really, really, really poor health. I had a moment where I basically eventually found a holistic doctor who actually told me that I had been told by many doctors that I wouldn't be able to have children. She was the first person to say, well, actually, I think if you quit your job and like basically changed every aspect of your life, you might be able to. So I took her words very seriously, and that is exactly what I did. I ultimately quit my job. I quit a lot of toxic habits that I had. I radically changed my diet and started meditating, and I tapered myself off of about 20 different, yes, medical and psychiatric medications down to zero,
Wow.
and eventually had no symptoms, like none, was in perfectly good health. And now I have actually two healthy babies. Yes. So it was a great story. During that process, basically, I had always had a little bit of a problem with traditional allopathic medicine. And it always seemed not quite right to me. But really, it was during that process of my own journey back to health and healing that I realized I can't keep doing this. I can't keep prescribing these drugs to people who are not getting any better. And I'm not offering them any reason to get better, right? Because we're not, the drugs aren't actually treating anything. So I decided to leave my job and launch a practice called free range psychiatry. So that was about 6 years ago. I essentially self taught myself everything that I know now in what I call holistic psychiatry. That's what I kind of call what I do. And so I've been for the past 6 years basically working with people through what I call like a holistic approach to help them with their, mental health issues. And specifically the niche that I sort of accidentally stumbled into is helping people to come off of psychiatric drugs. It turns out that getting on psychiatric drugs is pretty easy, but coming off of them, not so much. People struggle quite a bit. And so I've become basically an expert in helping people to get off these very, very difficult to get off drugs. And that's the short version of the whole.
No, that's incredible. What a journey. And did you have anybody guiding you when you were trying to get off of the 20 medications yourself?
No.
No.
I figured it out.
Oof.
And and
Yeah.
and knock on wood, it actually did not go so poorly. I'm extremely lucky that it actually went pretty well, which I now in retrospect attribute actually to my mindset. Now that I know everything that I know and have seen everything that I have seen with regards to people coming off these drugs, I had a mindset that I was going to get off. Like, it was going to happen.
Mhm.
I was gonna have a baby. I was gonna prove all of those doctors wrong who told me that I needed to be on these medications for life, who told me that I wasn't. I'm very, could be a little bit oppositional at times. So in my mind, I heard all of them saying, "Oh, you'll never get off these drugs. You'll never have babies." And I was sort of like, "You know what? I'm gonna prove everyone wrong." And so I think that was my biggest asset.
And you found such a gift in it so that you can serve from there.
Absolutely. Like, I wouldn't have changed a thing. People often say, like, well, if you had to do it all over, would you go back to mainstream psychiatry and do what you did just to get to? Because honestly, I went all the way and got all the training and residency and everything. And now I really don't use anything that I learned in medical school or residency. Um, but the answer is I would definitely do it all over again because
Mhm.
it's how I got to where I am today. And I
Totally.
absolutely love what I'm doing.
And it gives you that street cred, right? That you're like, no, I've gone through all of it. I did all of it for many years. In fact, I was a patient myself for many years and I went through all of it. It's not coming from something you read. It's so deeply experiential that when somebody comes to you, you're like, no, I got you. I got you. And what an incredible thing. It's incredible. Do you have any physician clients that come to you?
I do. In fact, actually, we have quite a few psychiatrists and other physicians as well. Yeah.
That come to you to get off of the medications themselves. And do you train people in this?
Yes, actually, so I launched the practice back in, so about 6 years ago, I launched the practice. After about a year, I think it was a year and a half of seeing patients just myself, I realized, holy moly, there are a lot, I mean, like millions of patients out there who are struggling to come off of psychiatric medications. And at the time, there was me and one other doctor. We were the only psychiatrists in the world that know how to do this. I had a waiting list of patients, which was nice for my practice, but I realized like there needs to be more people who are trained in doing this. So I've brought on four different, I think, psychiatrists or four or five different psychiatrists over the past couple of years. And then basically I founded a fellowship, actually. It's called the Free Range Fellowship. And so I train other doctors. We also have nurse practitioners, and we even have some non-medical, some coaches and other people that have now joined the program as well. But essentially, I am now training other people to do specifically what it is that I now know how to do, which is using this very holistic approach to get people off of really any kind of medications.
Yes, yes. I find myself trying so hard to do this with my palliative and hospice patients. And I'm just so blown away. When I started training about 11 years ago, people were coming to the hospital. I'm internal medicine board certified hospitalist, and I left that at the end of December this past year. And what's so interesting is that the average person coming in 10 years ago, they were on 3 to 5 medications. Now it's 15 to 20 drugs. You're like, what is happening? And I go to my palliative patients and my hospice patients, and I'm like, you're eating more drugs than you're eating food, and the toxicities and a lot of them are not ready to come off, right? So the people that come to you, they're ready. They're like, I'm done with this. I want to come off. And that is so beautiful that you have the protocols and the works, right, to get them off safely and during the period of time that they need to come off. Like some medications like Vraylar, you gotta have it's the craziest thing. You gotta do it over a year. Unless, you could get tremors from it. I've had patients who, through my own practice of the work I do with microdosing, they want to come off, and I'm like, ooh, I'm going to send them to you. Or maybe I will take your course, Kendra. Maybe I'll come through your fellowship. Yeah, it's so great.
And zero training. I don't know if you're like me, but I received zero training.
Zero training.
Deprescribing. None. Not a day of deprescribing did I get in my.
Never. We barely learned about medicine to
Mhm.
begin with, right? Things that really matter in medicine, in clinical practice of medicine. You don't learn anything about nutrition. Nutrition equals medicine, one and the same, or poison. And then you have pediatricians putting little babies on formulas full of chemicals. And I have friends who are reaching out to me. I'm like, your kid is dying, like for the third time they're in the hospital with a respiratory, just inflammation because of what's in Similac, you know?
Yeah,
And so I'm training them, and it's profit over all else is what's happened. Over
100%.
all else, no, let's keep you sick so you keep coming back for more. So we have to add all these medicines.
Yeah, I mean that's what feeds the medical industrial complex, right? Like it is all about money, and it works perfectly. The system works perfectly in as much as people say patients forever, and very, very, very dependent upon the system. As you say, coming in, on 15 different drugs. Like there's no like once you reach that level of polypharmacy, you're going to be a patient for life.
It is so difficult to even have that conversation with a lot of patients because they're so hung up on the medication, and their physicians we are their marketers, we're their distributors. They've sold this so hard to us. It's in our bones. We're like, no, you have to be on this, and that for that to be. And, I really struggle with that in this very moment, taking care of elderly coming in, and some of them are very stuck in their ways. And I'm like, oh man, you don't need to be on this every single day, like this antihistamine and this and that and that. And they have a really hard time coming off of it because they're like, oh no, my doctor said I have to be. I'm like, well, now I'm your doctor. But then trying to help them, guide them
Yeah.
even in that. It's very difficult.
Oh, it's very challenging. And so, I mean, what I see and the work that I do and sort of how I am using some of my social media platforms right now is very much just like planting seeds
Yeah.
because like, as a hospitalist, so you only get this like, glimpse of a patient per se, but sort of what I'm trying to do is like in any patient encounter, but also in, via the social media and things like that, just keep planting these little seeds, like just talking about like, what does it mean? Like a pill for every ill and like just this whole mentality of that we're developing. And so, yes, like some people, you may plant a seed and that might be it. But I'm actually seeing, like, I'm witnessing it. This is the crazy thing that I literally have seen live, especially like on my TikTok platform where I have a lot of followers, where people are telling me, I've been following you for 6 months. Like 6 months ago, I was super into my drugs. I never thought about it, blah, blah, blah. And then I started watching your videos and I started
That
questioning things and things started adding up and I started looking at this and looking at that. And then I made the decision 4 months ago that I was going to come off. And now, I'm off of all my things. And like, right. So like, and this is somebody that I never met, right? And I wasn't trying to convince them to come off their medications, but I armed them with the knowledge. I just
yeah.
planted these seeds, and I was just real and explained the risks. They slowly over time it sunk in, and they opted to do it on themselves for themselves,
Yeah, yeah, yeah,
right?
yeah,
Like,
yeah, yeah. No, you're 100% right. And I've since left the hospitalist practice. I was an academic hospital, so I left it. And now I'm in the community doing, palliative primary care, doing a lot of mental health, right? A lot of fear at the end of life and dying and all of that is happening is very interesting. And actually, I'm gonna ask you, um, you know, when you talk about holistic, are you also providing things like, let's say, kava for patients who truly have these anxieties? And so, how am I going to get through this? Right now, psilocybin is not legal in New Mexico, it is in Colorado, Oregon, and I'm training people in those states, in Australia, in Canada. We can use that at the end of life and it is magnificent, in the decrease of anxiety and all of that. But what other plant medicines do you suggest, let's say, for that anxiety um end of life, or whatever anxiety in
yeah.
general?
Well, so one thing that I just want to say, so a perspective from the holistic perspective, right? When you're having a symptoms, for example, anxiety, right? From a holistic understanding and a holistic lens, that manifests on different levels, right? So you have the biological, medical level, physical level for sure, but then there is the mental and emotional level, the spiritual level, the energetic level, right? So it's all
Totally.
these different, and so they're all, as you know, interconnected. They're just, you can't even dissect them because they're all, kind of one, bidirectionally related. And so my approach is to first of all try to understand the cause, right? So the medical the training that I got in medical school and training is that you have a symptom and then you have like a treatment for that symptom, right?
Mhm.
So instead of that, I start with, okay, you're having anxiety. Well, why are you having anxiety? So it turns out there's a billion different reasons why someone may have anxiety, right? And they
100%.
they include spiritual reasons. They include energetic reasons. They do include biological and physical reasons as well, but it's the whole sort of gamut. So when I meet a patient who's having a certain symptom, I don't just ask, what is the symptom? I ask, why are you having it? Why is this being presented into your life? And I also even start with the idea that a symptom is, in some ways, I like to think of it. I know this sounds kind of crazy, but it is almost like a gift. It's a portal
Yes,
because
100%.
symptoms are your body's attempt to communicate something to you, right? They are a communication. And so they are a valuable tool. And if you approach it as such, like with curiosity and love and compassion, why am I having this anxiety? I think it's so different from what I learned right in medical school, which is like, you have anxiety, anxiolytic, right? We just got to remove
Yes.
anxiety. It's like, we don't ask why. We don't ask why is this coming up? Why now? So I think that's super important. And so in the work that I do, I first off figure out why it's happening. And then secondly, I use all of different approaches, right? So I may ask them to change their diet, for example. For example, anxiety. How many patients, come in complaining of anxiety are also drinking alcohol and drinking and caffeine? So that's an easy,
Or
that's
smoking, right? The
or smoke,
nicotine.
yeah,
Yeah.
or not exercising whatsoever, or right. So there are tons of things, honestly, that make huge differences. And P.S., as you know, this isn't just me saying this. We actually have a study. That's what's so
There's
crazy.
so many studies, so
People
many
always
studies.
say, "Oh, we need more studies." We want more studies to know that exercise prevents depression. Like, I don't need any more studies to show me that. I can very confidently say that exercise is very effective to treat depression and to prevent depression. I don't need a study to tell me that. Uh, but yeah, so basically the idea is to use all of those interventions. But to specifically answer what you were asking about, maybe plants and other things that I might use in the context of anxiety, one of the, I would say from a biological perspective, the biggest contributor to anxiety that I actually see is actually lack of magnesium, which is interesting. So because of modern farming practices, the soil is becoming more and more depleted, and specifically of magnesium. So even if you are eating a like healthy diet these days, likely you're deficient in magnesium. I would say almost 100% of the patients I see are. So that's a super simple fix. Give you some magnesium. Simple. And I'm telling you, I can't even tell. I've cured people's anxiety. I've cured panic attacks. I've cured insomnia. I've cured, people who had been on benzos for years by giving them adequate magnesium. Super simple. So that's usually where I start. I also use something for anxiety quite a bit called L-theanine. I don't know if you've heard of that. So it's actually found in green tea. But that's super good, super safe, super well tolerated. You cannot become dependent upon it. Just sort of relaxes the system, can actually change your brainwave patterns and things like that. I don't use kava a lot because I've had some issues with kava, but some people find it to be helpful. Other things like lemon balm, some people find lemon balm to be really helpful. Lavender is another really helpful one. So there's lots. And I just want to say specifically too, like I always say, like, knock on wood, but in my practice and for the past 6 years of doing this work, I have not had to start somebody on a pharmaceutical. So what I'm trying to say is, these are not just like, people say, "Oh, just exercise and change your," like, that's not going to do it. I have really severe symptoms, really, because I don't buy it. Like, in other words, what I'm saying is I've been doing this now for quite a while. And what I'm telling you is that every single patient that I have ever treated has a cause that I can find for their anxiety. It's not just, "Oh, I randomly have anxiety." And it's not, "Oh, my mother had anxiety, so I have anxiety." No, there is always a root cause. And once you identify and treat that, in my experience, that's it. Like, everyone can get better. That's my opinion on this.
100%, 100%. And it's so interesting you're saying this because I work with physicians, mainly, and some of them have just tried so many different medications, just like you said. They've had, suicidality every day for like 10 years. And then we get into these. We get in deep into these practices. Sleep is another one that is huge, and we don't even think about it. We don't honor it. We don't honor our bodies in the resting form. We're like, "No, you got to go, go, go." We're so stressed out, and I am 100% on board with you with what you're saying about these changes in lifestyle make all the difference. All the difference. Get some sunshine every day. Get some sunshine every day. And there's data behind that too. Get fresh air every day. Go for a walk in nature, and immediately your brainwaves change. Within 10 steps, they've shown that our brainwaves change. It's huge, and it's simple, and it's free, and it's in harmony with us.
No. Well, that's exactly it. When you actually think about it, it makes perfect sense that these things are the things that we need because they are the things that we are missing, right? Like, it's not actually, when you when you really think about it, it's not like, we used to be outside in sunshine eating good food and we did not have those symptoms. Now we are living these high stress lifestyles on computers, not going outside. Like, so it's not really doesn't take a far stretch of the imagination to realize that if you replace these things that we need, that you're going to feel better, that there's going to be relief.
Do you find any opposition to what you do?
I find a lot of opposition to what I do.
How interesting.
Oh, quite a bit, especially on social media, especially on my TikTok platform where I have a lot of followers. I get a lot of hate. I get a lot of angry people at what I'm saying, a lot of anger. And I have been reported to the medical board several times. I have been investigated by the medical board several times. I have been found innocent of any wrongdoing. But yeah, there have been people who have like significantly threatened me, made significant threats, all because on my platform, I am sharing truths I am talking about like providing full and informed consent around the real actual risks of these psychiatric drugs. And I'm offering people solutions that are non-medication based. In fact, one of the medical board complaints says that she treats mental illness without medications. So I was accused of treating mental illness without using a medication, as if that is like a crime, as if that
illegal. Like,
yeah, yeah, that was the complaint that was literally investigated by the medical board. So yeah, I think this to me, it just speaks to the power of big pharma. It speaks to the level of brainwashing. I think that in our society at large, it's pretty big. And so I know that when I say some of the things that I say, I've definitely had other psychiatrists, I think, get angry. And I think there is a lot of cognitive dissonance, right? And I went through that, I will say too, right? So I paid like over $500,000 to go to medical school. I lost years of my life, right? All of these things so that I could be a psychiatrist who prescribed medication. And now I'm saying, wait a second, these medications are actually really dangerous and really bad, and I shouldn't be doing this. So I went through that whole process of sort of grieving. And I see that when I share this with other psychiatrists, it's like I'm touching on their livelihood, right? Like it's like hitting a nerve, right?
totally,
Because this is their life. This is their kids' college. Like, they need this system to be okay. And when I'm poking holes in it, that doesn't feel good. And I understand that. Yeah.
how this may be a silly question, but what keeps you going even when you do have the opposition, when you do get reported? And I'm sure there's like, tell me about what you go through when that happens or when that's happened in the past.
Yeah. Well, I will say this. In the beginning, it was a little difficult. I will say at this point in my life, it almost flows off me. Like it really does. I do a lot of inner work. So I have done a lot of trauma healing. I do a lot of Kundalini yoga. I do a lot myself. And so I would say that I am somebody who I don't live in a fear-based world, in a fear-based system. Like I have healed my nervous system. And so honestly, I'm at a point where it doesn't scare me anymore. It doesn't bother me anymore. I understand that when people make these threats or accusations, or when they're getting angry, that it says a lot about them and it's not about me, right? It's their own process. And I also know, just to answer your question, like I truly believe that this is why I'm here on this planet right now, is to do what I'm doing. Well, there's no other choice. Like I wouldn't do anything else. Like it is what I'm here to do. And so there's really nothing that's going to, I think, deter me, because this is what I'm soul aligned, right? This is what I feel like, why I'm here. So I'm just going to keep doing the work. And like I said, it doesn't really bother me that much anymore. So
That is so cool. That is amazing. And it is the inner work. And, you're standing in your own light and you're showing up for you. And you've done it for so long now that you're like, nope, it's fine. It's fine. Yeah, you see where it's coming from. That's the beauty of it. And you touched on trauma healing, and that's where I see people ask me, "Oh, is this good for addiction? Is this good for this?" I'm like, "Wait a second. Let's back off on these diagnoses. Let's ask those questions that you were asking, the whys, the fact that depression, anxiety, suicidality, addictions, you name it, they're all based in something that we have not examined and we have not worked through. Do you, and inevitably it's something that we perceive as a trauma for, that individual, and it's absolute in its own way. It's not, you can't compare. But do you practice a particular, or do you suggest people a particular way to work through their trauma and trauma healing? Or is this a gamut of different tools that you use, which is what I'm feeling, with that, especially that, who you are,
yeah.
and the femininity that you have, that you've, really tapped into, and the masculinity, of course, we need that too. But, yeah, what do you use? What do you suggest? You mentioned Kundalini yoga. Anything else?
Yeah. And actually, I just want to back up just real quick to say, I often joke that you could kind of like burn the DSM, the Bible, the psychiatric diagnosis manual, and you could just like sort of set it on fire and just say trauma, because really it's all the same. This is what's so silly. What I find so silly about psychiatry is oh, this person is depressed and this one's OCD. But why do we even describing the symptoms? It doesn't help us in any way. What's helpful is understanding what the root cause is, and essentially they're all caused at the root by some sort of trauma. I mean, that really is the root of everything. And so I just want to emphasize, like, I think that's so important. I don't really use diagnoses. I don't really believe in them, but I do think that trauma. Yeah.
Can I ask you one quick question? Because, and I believe in what you're saying 100%. People come to me, they're like, so-and-so has narcissistic personality disorder, or they have this. I'm like, just dig and see what happened in their childhood. And inevitably, it's so rooted, all of it. Yes and yes.
100%. I have not met an exception, and I have treated many thousands of people in my life, and I've never met an exception to that rule. So it always is. And so it's almost meaningless to throw a diagnostic label on there when it comes to like, okay, that's great, but how are we going to treat it? So I do think that healing the trauma, addressing the trauma, and again, I love what Gabor Mate, how he describes it. It's not the trauma, it's the disconnection that happens because of the trauma. So it's not that you were abused as a child, it's the disconnection that happened as a result of that abuse, in childhood. And so the good news about that, and I was just getting into a conversation with somebody on my social media about this, because they say, well, I can't change that I was traumatized. That can't be changed. Correct. The trauma cannot be changed, but that disconnection that was the result of the trauma can be. You can heal that. You can be reconnected. And I actually posit that is possible for everyone. There are many people who may disagree with me on that, but I believe that healing any trauma, and I have healed an exceptionally large amount of trauma myself, that anything can be healed. That is my belief. And that's why I believe that anybody could also be free from anxiety and depression and whatnot, because it's all connected. So if you heal that, all the symptoms are going to fall away. So when it comes to healing trauma, one thing I just want to say is where you start on that journey of trauma healing, and it's a journey, right? It's not as anyone who's done this knows, it's not like you just, you go to one session one time and there, I'm healed. It's very much a journey, and it's not easy. I also don't want to sugarcoat it and say that it's this beautiful process with, butterflies and rainbows. It's not. It gets dark and ugly and scary and hard. It's hard. It's facing demons, and it's a lot. But it can be done. Absolutely 100%. But I will say that one thing that I do recommend to my patients, and really just anybody who's interested in doing this, is that there is a benefit to starting with some of the like stabilizing things. I say like stabilizing things first. So in other words, you may want to clean up your diet a little bit, get your sleep a little bit under control, start some magnesium, get some of those little foundational things going. Also, depending upon how traumatized you are, especially if we're talking like severe, childhood sexual abuse, things like that. Like you want to have, if you're acutely suicidal, for example, right? And you have really bad childhood sexual abuse, I wouldn't say, okay, go start healing your trauma tomorrow. Right? What I would probably say is, okay, let's get you some magnesium. Let's do this. Let's make sure you're sleeping, blah, blah, blah. And now let's start to work on it. So that's just important, because I think some people sort of just want to jump into it, and you do have to be careful. Like there are some modalities that are a little bit safer, but oftentimes, especially with the population of people I see who are very, very, suffering quite a bit, I like to say, let's get you cleaned up a little bit and stabilized a little bit, and then we're going to work on the trauma. So as far as the healing of the trauma, again, since going back to like the holistic approach. So trauma manifests on the biological level, right? We know the issues are in your tissues, right? So it's stored in our body cellularly. It's also stored in our energy field, 100%. It's also stored as unprocessed emotions. Oh my goodness, that's a big, huge part of it, right? Spiritually, right? There's a big spiritual manifestation of when we were traumatized. Like that's huge. And so again, since we know that trauma is stored on these different levels, there are different modalities that one might try that actually go through those different levels. So for example, there are somatic interventions, like somatic experiencing, for example. That's a really, really, really effective one. So that's a good one. That works mostly sort of like on the body level, and a little bit also on the like sort of unconscious level as well. So that's a good one. Another one that's probably accessible these days, probably one of the most accessible modalities, is something called EMDR, which I like. I will say, I don't think it's effective for everyone. And I often find that a lot of times you may need EMDR plus something else, but I think it's a good start. It's a good place to start. And these days you can find like online EMDR. So it's very accessible. Like anybody, you can just Google and you can find somebody that does EMDR in your state. It shouldn't be a big deal. And then there are more things that are focused on like the energy in the body. So for example, like Kundalini yoga, that was a big part of my healing journey. Another one, as far as like the energy, aspect is concerned is just all the different modalities of energy healing, which I actually used. A big part of my healing journey was working with an energy healer, and that seemed to be actually one of the most potent things for me. I found out that I had a lot of stuff stored in my energy field, a lot of stuff. And so working with different ways of clearing all that out has been like huge, has been really, really, really helpful for me. And then, of course, there's things like psychedelics. So one of the reasons why I personally, by the way, love psychedelics, and why one of the reasons why I think they are so potent and so effective at helping people to heal trauma is because they work on all the levels,
Ooh,
right?
yeah,
So
absolutely.
it works. We know that there are biological changes, right? We know that the changes in the brain that are happening, right, with psychedelics, it works for sure on an energetic level
For
because of the
sure.
energy of the plant, right? That it's definitely changing our energy field. For sure, is working on the spiritual level, right? Absolutely. The mental and emotional level, absolutely, right? So it's sort of like one tool that allows you to address sort of the trauma that is layered in on all these different levels. And so I think that's why it's a really, really important tool. Though I always like to just
Yes,
reaffirm to
thank you.
everybody, it's a tool. It's not a cure all. It's not a
Yes.
panacea. You're not going to take some mushrooms and then all your childhood trauma is going to dissolve. Absolutely not. But yes, it is a tool, and it's a very potent tool, and it's a very effective tool if used wisely. And I like to say with sacred respect. Yes.
Thank you. Thank you. Thank you. Thank you. Yes to all of that. And people who go through my program, we do all of that work prior to even touching or talking about medicine. You got to be committed to yourself. You got to take responsibility. You got to know, hey, gain conscious awareness of where my traumas came in. And then maybe the medicine is for you. And maybe, that's it. And maybe it's not, and to be open both ways and to have respect and to know the sacredness of it 100%. And to know not to use it every single day.
Oh,
If you're going to use it every third day, cool, cool, fine. Maybe once a week, maybe once a month. Microdosing, I'm talking about, not macrodosing. A person may need it just once in their lifetime, and that's it. So, just raising awareness about it and having conversation about it, I think is really important because I do know people who we'll go to these South American countries, retreat after retreat, and you're like, what are you doing? Like, what are we doing here? What's happening? If you're truly trying to heal, why are you off, on a different planet constantly? Because the healing happens here, it doesn't happen elsewhere. That puts you, yes, connects you with your spirituality, and you said clears out energies and all of that, but you got to do the work. And you got to bring back the magic and learn, like in a dream state, something we see in our dream. How do I embody that in my life? And it is very sacred. This life is very sacred. This life on this very planet, in this very moment, is so sacred. So much had to happen universally in the galaxies for Earth to sustain life and to know what a miracle and to remember that. What a miracle it is to be on this earth is just magnificent in itself. But man, I'm so grateful for you standing in your own light and bringing what you bring to this world because we need it so badly. And I love that you have a big following. You have about 500,000, right? Followers on
over
TikTok.
100,000. So yeah, not 500,000, but over 100.
Over 100,000. Amazing. Amazing. We need more. Please, my listeners, I need them to follow you and learn the beautiful wisdom that you've gained through your own challenging experiences. Yeah. Yeah.
Appreciate that. And I feel a shift, honestly. Like, I don't know. I think you may, I know a lot of the
Yeah.
people that I know and work with, like we can sense it. Like there is this sense of things that are starting to shift. I think that people are becoming more conscious. People are waking up. Like it's palpable to me. And so it's beautiful. And I am like ecstatic if I get to be one little dot, in that ocean of wave. I'm thrilled to be here and to be a part of it because it's beautiful. It's absolutely beautiful.
Yeah. Yeah. Well, thank you so much for being here with us, Kendra. Is there anything else you'd like to share before we leave?
No, I think we covered all the big stuff. So I just again thank you so much for having me, and also thank you for all the work that you are doing. So much
Mhm.
appreciated. Beautiful.
Yeah, thank you so much, Kendra. And we would love to have you back, Dr. Campbell. And maybe we'll have specific questions from the audience that they want to ask you or but yeah, and tell us where we can find you, where the audience can find you, please. And we'll put that in the show notes also.
Awesome. So our website is just freerange.org. So there's a lot of stuff there. And then I have a lot of content on TikTok. So it's just free range psychiatry, all one word, free range psychiatry. And if you go to the TikTok channel, there are lots of videos by category too. So you could put like psych med tapering or whatever, and you can see all the videos that I've created on that, for example. And I have a link in my bio there. And in that bio link, I have lots of free resources as well, like how to heal ADHD, how to balance your hormones, how to, heal anxiety naturally. So you can click that link and there's lots of free resources available as well for people.
You are amazing. Thank you so much.